Hey guys, so in today's video, I wanted to talk about a question that I was asked, and I'm going to give some general information. So if you see me looking down, that is because I do have some notes written on my phone in front of the camera, so I do apologize. However, the question that I was asked is, can medical assistants triage? So if you don't know what triage is, it's basically like listening to someone's chief complaint and then figuring out whether they need to be seen right away, or whether it's something that can wait, etc., etc. If you guys want more information on triage, I can definitely provide that in a future video. Just let me know. So, can medical assistants triage? I will tell you that personally, I have done triage working in the pediatric medical assistant space. I was able to triage. However, they had a list of things so that if somebody was calling with respiratory issues, you would ask these questions. And if they answered in such a way, then you would tell them to do this, and so on and so forth, if that makes sense. So medical assistants can usually assist with triage, but they typically do not perform a full clinical triage independently. So this is especially in settings where triage requires licensed clinical judgment, like in hospitals or urgent care centers. So what medical assistants can do in triage: gather initial information like their chief complaint, their vital signs, as well as a health history. Use protocols to identify emergencies if trained and allowed by state law or clinic policy. So again, you can use protocols that, again, kind of like the list of questions that I had in the pediatric office. So alert licensed personnel such as a nurse, physician assistant, nurse practitioner, or the doctor if a patient appears acutely ill or unstable. So that would be something that needs to be dealt with right away. And follow standardized scripts or algorithms under supervision, such as the telephone screening tool that I was talking to you about, where they have everything listed out for you that they want you to ask and what you should do if they answer in specific ways. So what medical assistants usually cannot do is make clinical judgments about the urgency of a triage or the level of care that is needed, determine priority of care among multiple patients. Now, I will say that when I was triaging patients, I was dealing with, people who would call in on the telephone who were talking about like coming in to be seen for an acute visit or wanting to be seen again for something they were already seen for and just wasn't clearing up, things like that. So it's not like I was working in a pediatric urgent care setting. I was working in an outpatient clinic setting. So to continue with that, they also usually cannot perform nurse level or EMT level triage unless they hold additional licensure. So unless you hold, a nursing license or you are a medical assistant and an EMT, then you can't perform those duties. And typically, if you're working as a medical assistant, they don't want you to use your licensure. Depending on the facility, obviously, and what your job duties are, they don't want you to use your, like if you're working as a medical assistant, they don't want you to work as an EMT unless that's something that is clearly stated in your job description. So yeah. So key factors that influence a medical assistant's role are the state laws and the scope of practice regulations, facility policy, because some clinics might allow medical assistants to have more responsibility than others. There are some facilities that I interviewed with in the state of Indiana that would allow you to do IVs as long as you were trained and had IV certification, and they would train you to do that. There was an oncology clinic that trained you to hang the IV bag, insert the IV. You just couldn't actually start the flow of the medication. An RN or an LPN had to do that. I believe it was RN, had to actually start the flow of the medication because you weren't allowed to actually start the flow of medication, but you were allowed to insert the IV, hang the bag, and wait for the nurse to start the medication. MA's certification training levels such as a CMA versus an RMA versus on-the-job trained MA, which I don't really see how that would really affect it because medical assistants usually have the same scope of practice. But again, it could depend on what you've actually had your training on. So if you're in a clinic or a doctor's office setting such as outpatient, medical assistants are often the first point of contact and may appear to be doing triage, especially in smaller practices, but this is usually under a set protocol like the scripting that I was talking about and supervision. So like the scripting of if the person calls in for ear pain, ask them these questions, and if they respond in a specific way, then you would ask them this question, or you would tell them to do this and ask how long it's been going on for, things like that, just to get an idea before you talk to the provider and those sorts of things. And yeah, so hopefully this was helpful for those of you who may have been interested in this information. Again, I can provide more detailed information about triaging as a medical assistant or any duty of a medical assistant if you guys are curious. And yeah, I would love to help you guys. So leave it in the comments below and I will talk to you guys in my next video.